Good morning, everyone. I am Daniel Zambrano. I am a medical student, and this presentation is for medical English class. Today, I'm going to talk about dapagliflozin and cardiovascular outcomes in type 2 diabetes. I'm going to talk about the definitions, applications in medicine, pros and cons, applies in Ecuador, and finally, a conclusion. First of all, the definition. The definition of type 2 diabetes. The term diabetes mellitus describes diseases of abnormal carbohydrate metabolism that are characterized by hyperglycemia. It is associated with a relative or absolute impairment in insulin secretions, along with varying degrees of peripheral resistance to the action of insulin. And dapagliflozin is a drug, mainly a sodium glucose cotransporter 2 inhibitor. This drug are a relative new class of antihyperglycemic agents for the treatment of type 2 diabetes. Applications in medicine. Dapagliflozin 10 milligrams once daily improves glycemic control and reduces body weight and systemic blood pressure when added to usual background therapy in patients with inadequately controlled type 2 diabetes and pre-existing cardiovascular disease and hypertension. Pros and cons. First, the pros. Well, dapagliflozin reduces body weight, prevents cardiovascular disease, and improves the quality of life of patients with type 2 diabetes. And the cons, mainly the adverse effects. For example, risk of hypoglycemia, risk of congenital infection, and risk of developing diabetes ketoacidosis. Apis in Ecuador. Dapagliflozin in Ecuador is marketed under the name of Forxiga and comes in 10 milligrams tablets. The drug is easy to get and prescribed regularly. And finally, the conclusion: the results obtained from the use of dapagliflozin have been favorable, concluding that its use considerably reduces the risk of cardiovascular disease and improves the quality of life of patients with type 2 diabetes due to its hyperglycemic properties. Thank you so much for your attention.